Hello everyone. Today I'm going to discuss polycystic ovary syndrome with you. As the name suggests, poly means many. So polycystic ovary is many cysts in the ovary, and syndrome means a collection of different symptoms that occur together in a particular disease. Here is the basic anatomy of the female reproductive system. As you can see, here is the uterus with the endometrial lining, the two fallopian tubes along with it holding the ovary. Now these orange dots which you see inside the ovaries are the follicles. In order to understand the basics, the physiology and pathophysiology of PCOS, you need to know the three layers of a follicle. So if we zoom in, this is how a follicle looks like. Here is the oocyte, which is the egg basically, and then the outer layer, this is called the granulosa cells, and the outermost is the theca cells. So now normally what happens that the hypothalamus secretes GnRH, which is the gonadotrophin releasing hormone. This hormone goes to the anterior pituitary gland and secretes LH and FSH. LH is luteinizing hormone and FSH is follicle stimulating hormone. Now LH, it acts on the theca cells and produces androgen in the presence of an enzyme called desmolase. Similarly, FSH, it acts on the granulosa cells in the presence of aromatase and converts this androgen into estradiol. This estradiol is responsible for the LH surge from the pituitary gland. That is responsible for ovulation to take place. Ovulation means that one of the follicles, it will get mature enough to release its oocyte into the uterus. Now, the other follicles, they regress. So only one gets mature, it has sent its oocyte, the egg, into the uterus, and this particular follicle which has released its oocyte becomes corpus luteum, which is a yellow colored body, and it secretes progesterone. This progesterone thickens this endometrium and prepares the uterus to get pregnant. But if this particular oocyte does not get fertilized, then this thickened endometrium mourns its death and starts shedding through the vagina, which is known as the menstrual flow. In PCOS, however, this pathway is disturbed because there is an increased production of LH. Now, if there is increased production of LH, then it will produce more androgen. This increased androgen will also act on the adipose tissue, the fat cells of the body, and produce estrone from them. This estrone is also from the estrogen family, but it is less potent than estradiol. Now this estrone sends a negative feedback to the pituitary gland and asks the pituitary gland to stop secreting FSH because the body already has estrogen, so no need for FSH to make estradiol from androgen. Due to this decreased estradiol, the LH surge doesn't occur, and therefore there is no ovulation, and this partially matured follicle will go into cystic degeneration. PCOS is a very common disease in women. Around 1 in 10 women have PCOS, yet we are unable to find the exact cause of it. However, there are two important associated factors. Number one is genetic. Genes play a very important role in the pathophysiology of PCOS. If your mother has it, then you might have it too. The second is obesity, because in obese women there will be more adipose tissue, more fat, so the androgen will produce more estrone from it. Now that you know the pathophysiology, it's easy to understand the symptoms of PCOS. Increased androgen production will cause hirsutism, which is the male pattern distribution of hair, like on your face, on the abdomen, on the thighs. Also, it will cause oily and greasy skin, which will cause acne, and acanthosis nigricans, as you can see the pictures, that these are dark velvety patches over the skin creases, like the neck here, as you can see, and in the axilla or groins as well. The hormonal imbalance will cause irregular periods or sometimes amenorrhea. The lady might be subfertile or infertile. There will be insulin resistance due to obesity, which will cause type 2 diabetes. But remember that it's not important that all these symptoms are present together in a woman with PCOS. Some might present just with hirsutism and acne, and some with irregular periods. So now to diagnose PCOS, we'll check the hormonal levels. We'll see that the LH to FSH ratio will be more than 2:1 because the LH production is more in PCOS. The androgen levels will be increased, and if we do the ultrasound of the ovaries, then there will be more than 12 follicles in at least one ovary to diagnose PCOS, and the ovarian volume will be more than 10 ml. Normally, it is less than 10 ml. If you see this ultrasound picture, then this is the ovary, okay, and these black pockets you see, these are the follicular cysts. Okay. Treatment of PCOS is mainly symptomatic. The most important or the mainstay of the treatment is weight loss. Healthy balanced diet and exercise will help you regulate your periods and decrease the symptoms of hyperandrogenism. For irregular periods particularly, you can give oral contraceptive pills to suppress the production of LH and FSH. For hirsutism and acne, you also give oral contraceptive pills, and you can use laser therapy along with it. If the patient wishes to get pregnant and they're infertile, then in that case you have to give clomiphene, an estrogen receptor blocker, which will increase the LH and FSH production to stimulate the ovulation. And in ladies who are overweight and have insulin resistance, we can also give them metformin because it will increase the insulin sensitivity and help them to prevent type 2 diabetes. I hope this video helped you to understand the basics of PCOS. So if you liked it, then please share it with your friends and subscribe to my YouTube channel as well. Take care. God bless you all.